Hello, everyone, and welcome. I'm glad you could join us for this explainer from Afro Mosaic Health Guide magazine. We're continuing our series, Impacts on the Global Black Lifespan Journey, and today we're diving into a really critical starting point, birth trauma and postpartum mental health, specifically in Bahia, Brazil. So let's get right into it. Let's start with this big question. How does the very first day of a person's life end up shaping all the rest of it? It's easy to think of birth as just a single event, a moment in time. But it's so much more than that, isn't it? It's the launch pad for an entire health journey, and what happens on that first day can create these ripple effects that stretch across a whole lifetime, impacting well-being for both mother and child for years, even decades to come.
To really get a handle on the challenges in Bahia, we have to start with a core concept: obstetric violence. Now, this isn't some vague catch-all phrase. It's a specific definition used by the Public Defender's Office of the state of Bahia. What this does is frame harmful actions not as isolated mistakes, but as what they are, a form of violence with really severe consequences.
So, why are we focusing so intensely on this one period? Well, think of birth and postpartum care as this powerful convergence point. It's the exact spot where clinical practices, legal protections, and social pressures all meet. And it's this intersection that profoundly shapes the health outcomes for a new mother and her child. And this right here, this is the central idea for our whole analysis today. Maternal health outcomes aren't random. They're not just a matter of individual biology or bad luck. They are, so often, the direct and predictable results of the systems in which that care is delivered. We're talking about the rules, the resources, the culture, the whole shebang that governs how care is provided.
Okay, so how does this actually play out in Bahia? To really grasp the full picture, we need to map out 3 interlocking systems that a birthing person has to navigate.
This table really gives us a clear roadmap. We're going to examine the clinical system, which is dominated by a very interventionist model. Then there's the legislative system, which has a critical gap in protections. And finally, the socioeconomic system, where pressures like race and income create these compounded risks. And remember, these don't operate in isolation. They all influence each other. Let's explore the first one. First up, the clinical system. The dominant model of care in Brazil is what researchers call biomedical and interventionist. In practice, that means it often positions the health professional as the sole authority. This can seriously diminish a woman's own knowledge, her desires, and her choices, creating a significant power imbalance during one of the most vulnerable times in her life.
And this is what that power imbalance can actually look like. These aren't rare events. We're talking about physical acts like applying forceful abdominal pressure, performing surgical cuts without consent, denying a person their chosen companion, and even verbal abuse related to a patient's race or their expressions of pain.
Next, let's look at the legislative system. And here we find a major vacuum. Despite having clear definitions and documented practices, the state of Bahia currently has no specific statewide law that formally defines and, this is crucial, criminalizes obstetric violence. This leaves victims without a direct legal path for justice.
And this isn't just a theoretical gap. This quote shows a concrete attempt to fix it that failed. A bill was introduced to create a state policy against this violence, but it was just shelved. It was archived at the end of the legislative session without ever getting a final vote, which really shows a lack of political will to formalize these critical protections.
And finally, we have the socioeconomic system. The pressures, of course, don't stop at the hospital door. Factors like race, low family income, and work-related stress, whether it's from unemployment or a high-pressure job, they all converge. They create this compounding effect that significantly increases a mother's risk for poor mental health outcomes after birth. So, the crucial point is understanding how these systems translate into tangible, measurable health outcomes. What is the real-world impact of this clinical, legal, and social environment? The scale of the problem is just immense. National data shows that about 1 in 4 women in Brazil reports having experienced some form of violence during childbirth. That number, 25%, tells you this is a widespread, systemic issue, not just a few isolated cases of bad practice. And this chart, wow, it provides a stark visual of the consequences. In one study comparing care environments, the prevalence of postpartum depression was 28% in public hospitals. Compare that to just 8% in private ones. The takeaway isn't about the women themselves. It's about the system of care they're in. The environment is a powerful predictor of mental health. And when we break down the risk factors for postpartum depression, a really clear pattern emerges. Studies consistently point to social determinants. Factors like being Black or brown, having a low family income, a lower level of education, and lack of social support. See, these aren't biological predispositions, they are societal conditions that are interwoven into the system. So, given these challenges, what's being done? Let's turn to the formal responses, the support structures and policy reforms that are in place or emerging to address them. Okay, the primary support structure is Brazil's Psychosocial Care Network, known as RAPS. It's designed to provide community-based mental health care. In Bahia, this includes 263 specialized centers called CAPS, where you have multidisciplinary teams of psychologists, doctors, and social workers offering support. On the policy front, there's been a really significant evolution. The original maternal health policy, the Stork Network, focused broadly on humanizing birth. But the new framework, Ready Align, which came about in 2024, represents a huge strategic shift. It is explicitly designed to tackle the deep-seated racial and regional inequalities that drive these poor outcomes. And the mission of this new policy is unambiguous. This quote states its primary objective very clearly: to cut the maternal mortality rate for Black women in half by 2027. It's a targeted, ambitious, and data-driven response to the systemic inequities we've been talking about. This brings us full circle, right back to our opening question. Why does this early trauma matter so much across the lifespan? How do these experiences in the delivery room and the weeks after continue to affect a family for years? The consequences are profound, and they are long-lasting. Unaddressed birth trauma and postpartum depression can impair that crucial bond between mother and infant. It can affect a child's cognitive development and increase the mother's risk for chronic mental health issues. It can strain family relationships. And crucially, it can also create a deep distrust of the medical system, making it less likely that a person will seek care in the future. And that leaves us with a final critical question to think about. The health system is fundamentally designed to provide care. So how can that same system be redesigned from its policies to its practices to actively prevent harm and ensure that a person's health journey starts with safety and respect, not with trauma?
This explainer is a production of Afro Mosaic Health Guide magazine. To continue following our series on the impacts on the global Black lifespan journey, please visit us at amhg.ca and subscribe to our channels on YouTube, Facebook, X, and Instagram.
Bye for now.